thumb is so much hurting that I cannot move it, and it has become red and swollen, and all the acute flare-up signs would be there. So that is a very typical scenario for pseudo gout. So you just have to remember that that can be underlying pseudo gout. And then when you take joint aspiration from this patient, because you have to rule out septic arthritis and gout. This is very important. Why we're aspirating? Because we want to differentiate. It can be a septic arthritis, it can be a septicemia, it can be a gout. Whether it is a pseudo gout, you have to delineate that. So after seeing that, okay, there is CPPD crystals, in 60% patient, you can have the positive birefringence. Then when you've diagnosed it, then okay, then go for the treatment. So acute condition, you can do joint aspiration to relieve the patient. You can do a steroid injection, cool packs, and temporary rest and protection. So that's very important that we are doing a steroid injection because it's an acute condition, as I've told you. And also in chronic cases, then when the patient, the acuteness is gone, then you can like put them on NSAIDs with some gastroprotection. Also, you can give them low-dose prophylactic colchicine, but NSAID is the go-to drug in that case. So I'm giving you an outline that how our guideline course will be. So we have finished the total crystal, and in that way, you can see that we have covered this crystal from the objectives, and that is one of the objectives for acute acute cases for oligoarthralgia. So that's how you should be approaching Toronto notes, and that's how you should be approaching your way of studying a Toronto notes, and matching it with the MCC objectives. And just keep on listening to my videos. I'll be uploading a lot of videos like that. If you liked my videos, do subscribe. So each cases or each classes or session after that, we're gonna show you some brainstorming questions. So this is just again an intro. So the brainstorming questions, today we'll be sharing some of the questions regarding the crystal arthropathies. So here you go. Just I'm going to go through the questions with answers, and at the end of the slides, we're going to give you the answers. First, you try to get the answers written down somewhere, and then you can match them with the answers that I have. So a 78-year-old patient with history of diabetes, type 2 and hypertension was admitted to ER with small bowel obstruction. He underwent emergency laparoscopy. On second POD, postoperative date, developed acute diffuse swelling of the right knee with profound redness and tenderness. What is a provisional diagnosis? Acute rheumatoid arthritis, acute osteoarthritis, acute gout, or acute pseudogout? Question number 2. A 50-year-old man developed swelling in his knee. It is red and warm, and arthrosynthesis is performed and came back showing rhomboid positively birefringent crystal. What is your treatment at this moment? Allopurinol, probenecid, colchicine, indomethacin. Question number 3. 78-year-old patient with acutely red and swollen right great toe without history of trauma. Which one of the following would be the greatest diagnostic and therapeutic value of the patient's condition? Joint aspiration, good response to colchicine trial, radiograph showing marginal joint erosion in the first MTP joint, and associated right ankle effusion, painless elbow nodule. So question number 4. 62-year-old male came to the office with pain and swelling of the left great toe at the MTP joint. Examination is shown that there are acuteness. The patient has a history of diabetes, controlled with diet and hypertension. Controlled by diet, and he also has hypertension. His medications include hydrochlorothiazide 25 mg per day. A CBC and blood chemistry profile are normal except for uric acid level of 10. So normal is 3.6 to 8.5. Which one of the following is true in this situation? Joint aspiration, good response to colchicine trial, X-ray showing joint erosion at the first MTP and associated right ankle effusion, painless elbow nodule. Question number 5. 79-year-old admitted to the hospital because of sudden inability to ambulate. He has a past history of gout. His temperature is now 100.8 degree Fahrenheit. Bilateral knee effusions. WC count is 20,000 with 82% segments, segmental neutrophils. His serum uric acid level is 8.5 milligram per deciliter. Which one of the following would be most appropriate at this point? Is it a 24-hour urine collection for uric acid, arthrocentesis, initiation of allopurinol, initiation of antibiotics, initiation of furosemide? So one thing I wanted to tell you that first you have to look at, whenever the question is delivered to you, first look at the question. So you see, they're saying which one of the following would be most appropriate at this point. So then you just go through that, what else you should be picking up from these scenarios. So the patient has some positive symptoms now. Okay, so 38.2 degrees Celsius temperature, bilateral knee fusion. There is leukocytosis, and neutrophil count is 82%. Even they have high uric acid. So your acute management for this patient that they're asking for. Question number 6. Which one of the following is true regarding the treatment of acute gout attacks? If uric acid lowering drug is not already being used, one should be started immediately. IV colchicine is the treatment of choice for the patient with peptic ulcer disease. Generic NSAIDs are rapidly effective in most patients. Untreated hyperuricemia is a contraindication for the use of COX-2 inhibitors. And then we're going to go to question number 7. 65-year-old comes to emergency department with right leg and knee pain. It has progressed for the past 2 weeks, and now they cannot even bear the weight on the right leg. Now they have recent history of pulmonary embolism and is on warfarin. INR is therapeutic. She is allergic to aspirin and penicillin. On examination, she is febrile. Her pulse rate is 102, blood pressure is 160/96, respiratory rate is 14 per minute. Right knee is erythematous, warm and tender on palpation of the entire knee joint. Large effusion is noted. Arthrocentesis reveals numerous WBC and negatively birefringent crystals. What is the best initial treatment for patients' knee problem? You give them ceftriaxone IV, prednisone intraarticularly, colchicine orally, indomethacin orally, allopurinol orally. Question number 8. 60-year-old with acute of pain and swelling in the right big toe. He can recall no mechanism of injury. He has hypertension which is well controlled with hydrochlorothiazide. On examination, the area on the toe is slightly warm. Which of the following should be avoided in this patient at this time? So allopurinol, colchicine, NSAIDs, prednisone, aspiration of the joint. Now, question number 9. A 60-year-old comes with a history of 2-day history of swelling, erythema, and pain in the first MTB. This is the third time this year that they had this problem. So remember, third time. So more than 2 times in a year is a chronic one. So he has treated previous episodes with over-the-counter pain medications, ice pack, rest, and elevation. Now, gout is the diagnosis on your evaluation. So which of the following treatment for gout is most likely for this patient to stop his symptoms to get from worsening? So is it allopurinol, colchicine combination therapy, oral corticosteroids plus colchicine, indomethacin, or prednisone? Now, question number 10. 60-year-old male complains of severe pain in the right big toe. The pain he found on waking up at night before and is not feeling any, and it is not felt in any other joints. He states that he's never had nothing like this before. Now he is on thiazide, so that is one of the precipitants. His heart rate is okay. Respiratory rate is 20 per minute. So we're just looking at the positive symptoms. See, the right big toe swollen, warm, and red with limited mobility of the MTP joint. Rest of the examination is okay. So what is following test is expected to have the highest diagnostic yield? Measurement of serum uric acid concentration, measurement of 24-hour urinary uric acid, lab analysis of joint aspirate, X-ray of inflamed joint, measurement of renal uric acid clearance. Question number 11. 83-year-old female with pain, swelling, erythema of the left knee, with some swelling and pain in her right wrist. So she noticed the problem last night before going to bed. She is healthy and not on any medications. Now she is sexually active, being widowed 15 years ago, and she currently lives with her sister. That the pain and swelling in her left ankle also developed 2 years ago that lasted only a couple of days with osteoarthritic nodes and resolve spontaneously. Blood testing shows a very elevated ERC rate, but a normal rheumatoid factor and uric acid levels, so they are normal. Which of the following is most likely diagnosis at this point? Gonococcal arthritis, gout, cedar gout, rheumatoid arthritis, rupture of the anterior cruciate ligament. So these are the some questions that I've just shared with you, and now these are some takeaway notes that you can always go through the notes. I think they're gonna give you some kind of look into some of the very important factor while you're going through the Toronto notes. These are some extra materials that we're putting in, so you can have a screenshot of them and try to go through them whenever you have spare time. And also this is some extra information. This is other than the information from Toronto notes, but these are very important, I'd say the PowerPoints, so you can also go through them also. So these are the answers for all the 11 questions that I have told you, so you can match up those answers. Remember, MCQE1 is a very simple but tricky exam. There's some vague information, so you have to get those information all constructed and to be specific. So they want you to be specific. They want you to come up with the best possible answers. And how we're going to do that? You have to have confidence that, for example, this is the crystal arthropathy. I know everything about it, so bring it on. I'm gonna nail crystal arthropathy. So there you go. This is something that you have to nail. So if you want to see, you pass it with a 1 SD or 2 SD above for MCQE1. This is the way you should be studying Toronto notes. This is the way you should be approaching the MCQE1. So never lose your hope. Keep on trying and keep on listening to the video. Again, if you like the video, do subscribe the videos, and if you like the guideline course, do leave us a comment. Next time I'm gonna come up with more videos. Till then, take care. Thank you.